I have Mr. Filey here to verify that I am not cheating. This is Miss Jordan. We are going to do a chest, thorax, and cardiovascular assessment while also looking at the extremities. So first I'm going to check the chart to ensure that I have a order to perform this type of assessment. I'm going to provide for privacy and wash my hands and introduce myself. Hi, my name is Olivia. I'm going to be assessing you today. Can you go ahead and tell me your name and date of birth?
Jordan Haney, October 20th, 1990.
Okay. So you want to identify the patient with two patient identifiers, so their name and date of birth. How are you feeling today?
Good.
Good. Do you know why you're here?
For a checkup.
For a checkup? Okay. So just go ahead and lay back real quick. I just want to do a general overview. All right. So as a general overview, her respirations are regular and unlabored. I don't see any use of any accessory muscles. She doesn't appear to be in any respiratory distress. There's no pursed lip breathing that you would see in COPD patients. I am actually going to have you sit back up on the edge of the bed and go ahead and take off your shirt.
You don't have to take off
No?
your shirt. Yeah, just
Okay. Maybe we don't.
we'll just lift it up.
Yeah, that's sure.
Okay.
So any shortness of breath, any coughing,
Mm-mm.
trouble breathing while you're laying down, any history of any like respiratory infections?
Nope.
No. Do you usually get like an annual flu vaccine?
Yes.
Yeah. Okay. When was your last one?
September.
In September.
15th.
Okay. How are your breasts doing? Are they even?
Yep, they're symmetrical.
One bigger than the other at all?
No.
No. Do you perform any breast self exams on yourself?
Yes.
Yeah. How often do you do that?
Once a month.
Once a month. Okay. Have you noticed any like abnormal lumps or lesions? Any discharge? No? Okay. So we're just going to inspect the chest for starters. So with the balls or the tips of your fingers, we're going to check for like crepitus, which is when the air gets underneath that tissue. And we're just going to do this over and into the axilla. We're also going to be checking for any swelling or tenderness. Just let me know if that's tender or painful for you. Meanwhile, we will be watching her facial expressions to see if she grimaces like in pain. Just from her overall assessment, her skin is warm and dry. I don't see any lesions or any masses. I didn't feel any. So now I'm going to go ahead and percuss. So for starters, you want to find that sternal notch. That's suprasternal notch. Go down to that angle of Louis, which meets up with that second rib. Go down just a little bit, like a finger space below, and that's your second intercostal space. And this is where you would percuss. So we're going to, with one of your fingers, you're going to take it and put it into that second intercostal space. Give it a great big tap, and you're going to do it on the other side. Because you always want to check both sides to see how they equate to each other. And then, so since we are at that second intercostal space, we're going to go down. One more. Now, you might want to be a little bit careful because breast tissue can give you a dull sound. So you don't want to do it over breast tissue. Go ahead and lift up your shirt. We're going to do a couple times lower. And you want to be careful when going on to the right side in the front because you may hear some dullness over that liver. It's a little bit duller there, not as resonant. Should be resonant throughout. And you're going to go down about every 2 intercostal spaces to percuss on the front. To do it on the back, I'm going to have you spin around. Okay. And on the back here, we're going to find this bony prominence. If you can just put your neck down a little bit for me. This bony prominence is C7. And then so you can start, if you go over, this is where the apex of the lungs would be. And you're just going to tap on each side. And then going down, you're going to find your scapula. So go ahead and give me this arm, go back. The bottom of the scapula, which is at T7, T8, depending on the size of the person. Then you're going to go down 1, 2, 3 to T10, which is the base of the lungs at resting or at exhalation. On inhalation, they'll go down to 12, so you would want to go down 2 more. So for percussion, we would do in between the scapula a few times. So let's find, and make sure you don't want to do it over the spine, because then you'll only get the sounds that the bones make.
So it's 1 to 2, so that's normal. No barrel chest or anything. You can sit down, and I'm going to
Bottom of the scapula at that T7.
When I put pressure on you, go ahead and say 99.
Now you might hear some dull sounds on the right side for that liver if it comes back far enough. And then you might hear some visceral dullness on the left side if your person is really skinny, and you might be able to palpate their kidneys. Alright, so overall there was resonance sounds throughout. You can go ahead and put that down. Actually, you know what? We're going to look this back up. I'm going to find in your arm. We're going to do scapula, T7, 1, 2, 3. We're going to go down to T10. We're going to check the chest expansion. So you're going to go down to T10 and grip them firmly and have them take a deep breath. So go ahead and take a deep breath for me. Okay, so in checking for this, you want to make sure that it's symmetrical, that one side doesn't inflate more than the other. So they were both symmetrical, didn't notice any deformities, no atelectasis or like barrel chest, which would compromise the flexing ability of the lungs. If you can just go ahead and swivel back around. Okay. Yeah. So for
So I'm going to start avoiding the scapula, start at C7.
we're gonna auscultate the lungs. So these areas are kind of the same as for the percussion. You're gonna find your suprasternal notch and go down to that angle of Louis and go over and down to that second intercostal space and listen about 4 or 5 times in the front. Just depends on how big the person is. And then on the back, we're going to use the same landmarks, starting at the C7 on either side to listen to the apex. Couple spots in between the scapula. That scapula at T7, you're going to listen below at like T8 and then T10, and then go around to the sides to T8 and then up to T6. Okay? And you're going to want to listen 1 full breath for each. So for starters, you're going to find that supraclavicle area and listen for the apex. And do it. Okay. And go on this side. That suprasternal notch, come down to that angle of Louis. I'm going to go over and down. And over. Always wanting to compare both sides. So you might want to be careful because breast tissue can get in the way. Alright, I'm just going to have you lift up your shirt.
No, but you can take it.
We're going to listen. Alright, one more time over here. Okay, So on the front, there was no adventitious breath sounds. They were clear, not diminished. Go ahead and turn around. We're going to do the back. All right, so like I said, you're going to want to find that C7, bony prominent C7T1. On either side will be the apex, the posterior apex. Breath. On the other side. All right, then we're going to go down a couple times in between the scapula.
But now I don't remember what you said.
I think I mixed them up. Yeah, I think I mixed them up.
And we're going to move over to the side. So you're going to find that scapula, where the bottom of that scapula is, and you're going to go over to the side, and that moves it to T8, and then you're going to move up to T6.
I saw your feet.
My socks left indents on my feet.
Go ahead and lift your shirt down. So that is the landmarks for the posterior lung fields. They were clear, non-diminished, no adventitious breath sounds like crackles or wheezing. You can go ahead and turn around. Now we're going to do some cardiovascular questions. Have you had any shortness of breath while laying down? Any history of any heart problems? Any edema? Any coldness or tingling in the extremities? No? Okay. So for this, the landmarks that we're going to use are, you're going to find that suprasternal notch again. And you go down and find that angle of Louis and go over. That gives you the second rib. And go down to that second intercostal space, which is like a finger breadth beneath. That's going to be the aortic, which is on that right sternal border. We're going to go straight across onto the left side, so that left sternal border, which would be the pulmonic. We're going to go down a rib, down an intercostal space to the third. The left sternal border is going to be that Erb's point. Nope, yeah, you're going to have to go ahead and lift your shirt up for me. And then from that third intercostal space, you're going to go down to 2 to the fifth intercostal space. So, fifth intercostal space, which is going to give you that tricuspid. And that's still on the left sternal border. And then you're going to move over mid-clavicular line, following that fifth intercostal space. That's going to give you the mitral sound, and that's also the PMI and where you would find the apical pulse that you would have to listen to for 1 minute. So we're going to go ahead and listen.
The same 3 spots. Can you take a deep breath, let it out, and then hold it?
And if it's hard to hear, you can always have your patient take a deep breath, blow it out, and then hold. That way you don't get the interference of their lungs. So herbs. Go ahead and lift your shirt up. So from the third, we're going to go down 1, down 2. To our fifth, listen to the tricuspid. And then we're going to follow this mid-clavicular all the way down.
I'm just going to feel around up here. Is there
In here, you would want to check the carotid pulse to make sure that they equal each other. So when you feel the carotid, you should hear the apical pulse beat. And I do. They are simultaneous, which is good. Her heartbeat was steady and regular. I didn't hear any extra sounds. S1 and S2 were strong. You're also going to want to note like the hair distribution on both of the arms. I don't see any abnormalities. There's good hair distribution, which means that there's good cardiac circulation. On the legs, if you want to go ahead, I'll lower this down a little bit. Yes, please. And we're just going to check for like edema. It's like a +1 mild pitting, nothing major. Check her toes. Make sure that her cap refill is good. Cap refill on the toes is good. It is less than 3 seconds. Can't really check her hair distribution on her legs because she shaves, but I can still see the pores, the hair follicle pores. And it looks evenly distributed among her legs. Doesn't look like there's any extra spaces. We're going to check the cap refill on her fingers. Okay. All right. And then we're going to check her pulses. So we're going to work our way down. We can feel her carotid pulse, which is good and matched up with the apical pulse. We're going to do the brachial. So if they have the patient extend their arm, you can feel, move that bicep over, and it should lie right underneath that bicep. You can find it a lot easier than I did when I did your blood pressure. And then you're going to want to do the radial. And you're actually always going to want to do these simultaneously just to make sure that they were equal and regular, which they are. We'll find it on this one too. Sometimes this pulse is a little harder to find because you can't obliterate it if you push too hard. All right, you usually do the femoral pulse, but for the purposes of this video, we will not be doing that. And then we're going to do the popliteal, so we're going to have you bend your leg a little bit, just a little. And in between, there's a tendon back here. Do it this way. There's like 2 tendons on either side. It should be like right in the middle. Sometimes it does deviate to the side a little bit. I know mine does. This one. And that tendon. And these are both +2 regular. I don't feel any abnormalities. We're going to go down the posterior tibial to this, right behind like the medial malleolus. And I'm going to feel back here. Sometimes these ones are kind of hard, depending on where they lay. Alright, then we're going to do... Okay, so those are both a +2 normal. I don't feel any abnormalities. Strong. And then you're going to find a tendon that follows your big toe. Just follow it upwards on the foot, and you should be able to feel the dorsalis pedis. Both are +2 and strong, which is very good. Sometimes pedal pulses are diminished, which means that the circulation is poor. But their feet are warm and dry. Arms are warm and dry. And I think that concludes this video.